before I got introduced to the patches, I had a janitorial service. I'm 72 years old, and I've always been very active, very energetic. My kids tell me that I can work circles around them. So after I had a car accident back in 2020, I ended up with a herniated disc. They did some kind of procedure on me with a long needle, and it kept the pain away. But the orthopedic surgeon told me that it would come back in about 2 years. I didn't believe him, but he was telling the truth because it came back with a vengeance. From my hips down, everything was sore, and I was having a really hard time walking. I felt like I was going to end up having to start walking at least with a cane, possibly even with the walker, because my legs would actually give out from underneath me. And this was very discouraging. I was ready to give up because I'm not that type of person. I just couldn't stand the thought that I was going to not be able to be active and enjoy life. So long story short, a friend of mine, Paige Hunter, introduced me to the patches, and she said that God had been telling her that she had to tell me about it, me and a friend. So I decided, okay, I'm going to try it. Didn't know any better. Put one of the X39, that's the only thing I had, put the X39 on at night before I went to bed. Didn't bother my sleep at all. But when I got up the next morning, I had about an 80% reduction in pain, and I had about a 50% increase in the mobility in my legs. When I realized I could actually bend over and it didn't hurt, my first thought was, you have got to be kidding me. This little bitty patch couldn't possibly have done that much. Because I'd gone to physical therapy for 3 months. It did absolutely nothing. And I couldn't figure out what it was I was supposed to do. So I started looking into the patches at that point. I've been on the patches now for 7 months. And there's been so many things that have started happening that I just had no clue that it was going to be like that. My hair started turning dark again. And then not only is it turning dark, but it's getting the blonde streaks in it that I had when I was a kid. That's just been recent. I have a surgical scar that's about 50 years old down the middle of my belly. It totally flattened out, and about 3 inches of it is gone. You can't even tell that it's there. I have a few scars on my hands, same way. Arthritis in my thumbs. And it was painful. I was taking glucosamine, and I know you're not supposed to do this, but I stopped taking glucosamine because I wanted to see what this would do. And now once in a while I'll get a twinge, but pretty much the arthritis in my thumbs are gone. I didn't even know I had sinus issues, but all of a sudden I can breathe better. So I guess I had sinus issues and didn't even know it. Little by little, all these things are happening. The most recent one was that about 6 months, 6.5 months, I decided that it was time to go get my blood work done. I have type 2 diabetes, and I've had a thyroid issue. The doctors and I have been working on getting my blood work in order. So getting it back to normal for several years, and was kind of at my wit's end as to what I was supposed to do. But I went and got the blood work. When I went in to get the results, she came in and said she was just blown away with what was going on. All of my blood work was normal, except for my diabetes. And my diabetes, the AC1 had dropped 2 points. And she was ecstatic. As a matter of fact, she said, I've got some patients I want to refer to you to talk to about the patches. So that's been my journey. I wish I had time to tell you my sister's, because I feel like that mine is absolutely nothing compared to what happened to her. She was diagnosed with stage 4 cancer. And 4 months after the diagnosis, after the doctor telling her they couldn't do anything for her but keep her comfortable, 4 months later, they did a PET scan and a CAT scan, and there is no discernible sign of a cancer. It's gone. Now she did, lifestyle changes, dropped the sugar, different things like that. But I have my sister. I'm not going to lose her. So I am absolutely as thrilled with hers, if not more so, than I am with mine.
The herniated disc, when you had that, what was your pain level?
When I first had it, the pain was actually not too bad. It was after whatever procedure that they did with this real long needle that they put in the middle of my back. About 2 years later, almost to the month that they had that done, is when the pain started. And it just started to where I didn't realize it, but all the muscles in my legs were just like tight rubber bands. They were just pulled so tight, is the only way I could explain it. It was exhausting just to walk to the mailbox. And having a janitorial service, last summer, we did a 75-acre Christian school, and we deep cleaned and everything. And I couldn't do anything but just walk from building to building. And I was just so exhausted when I got through, because it took so much energy just to walk, because the muscles were so tight. And I was in constant pain. I guess if you wanted to measure the pain, probably about an 8.
Okay. So your body is repairing. And what's your pain level now? I know that your body hasn't completely healed your disc.
No, it hasn't. And the funny thing is that the stiffness that I was feeling, it moves around. It started in my hips and my legs. Now if I've started walking, so I got up to about 1.5 miles with a friend of mine. So I'm determined. I mean, I did a 100K bike ride before my 65th birthday. That was my goal.
Oh, wow.
So, I mean, that's how active.
Someone asked what kind of cancer it was, Penny.
It was stage 4 colon cancer.
Colon cancer. Okay. Well, go ahead and share just a little bit about that, if you will.
My sister is awesome. When the doctor told her that, she didn't accept it. And she just went on with a positive attitude that she was going to beat this. And I think I worked for an oncologist at one time, and I know the mental attitude has to be right, or you're not going to get well. So when I realized what she was willing to do, she juiced, she got the sugar out of her diet, she increased her supplements, and she used the patches. And she used the patches the days that she wasn't doing the chemo. So the day she did chemo 6 days out of the month, and the rest of the month she would use the patches. And she used X39, Eon, Carnosine, and glutathione. Those were the 4s that she used. She just, kept pushing. And every time she'd go in to see the doctor, she'd say, "Don't you feel bad?" And Linda would say, "No, I feel good." No fatigue. Her hair started falling out in December when she was diagnosed, when she started the patches. And then by January, her hair quit falling out, even with the chemo. She didn't have the fatigue. She had very little nausea, just a few days. And she just, kept pushing, doing what they told her to do. But she said that the 3 days that she was on chemo, by that Saturday morning when she could put the patch back on, she said she was so ready to do that because she was so tired by Friday night. And then Saturday morning she'd wear the patch, and she said right away her energy level jumped. You can't say that it wasn't the chemo, that it was the patches that got rid of the cancer. Nobody knows that, so you can't say that. But what she can say is that it helped her tolerate the adverse effects of the chemo, and that's what she tells people. I'm my personal opinion is that the patches is what killed the chemo, but I'm sure or killed the cancer, but I'm sure the chemo had something to do with it as well. But it helped her sail through that episode in her life without having the side effects from the chemo.
Mm-hmm, mm-hmm. Now, is she still currently doing the treatment as well as patching?
They have not done any treatment. It was almost funny when the oncologist, the surgeon or the oncologist did not know she was doing this. They would have told her no. She didn't want to get told no. So she just went ahead and did it on her own. But the most that the oncologist said was, there's been improvement. And I almost laughed because we'd already looked at the results and it said there was no discernible sign of the tumor. Now the surgeon was a little more forthcoming, but he still didn't want to know what she had done different. He still wants to do surgery. I honestly believe he wants to do surgery because he wants to see what happened, because they don't know what happened. They can't figure it out.
Well,